it's working. Yeah, it's working. So let's open the case. Yeah, there is not a lot of things, and in that exam, when there is a lot of not a lot of things, is the worst case, to be honest. Okay, the more they give you, the better it is. So I will open. You don't have this. You don't have any specific timing, is it? 3 and the 12, the normal timing.
Yeah, please.
Yeah, sure. Okay, this is the 3 minutes. You can read, and then when you're ready, let me know.
I'm ready for the 3 minutes.
Well, you can see the timing. Yeah, here
Yeah.
the time you can see. Okay, so the 3 minutes already going on.
Okay.
Okay, go ahead.
Hi, my name is Fatma. I'm one of the doctors in the practice. Could you please confirm your full name for me?
Oh yeah, doctor, I'm Jack. Jack Whitehead, doctor.
Yeah, and your date of birth, please?
I'm 55 years old, doctor.
All right, yeah. And how can I help you today, Jacques?
Well, doctor, I sent a photo. Have you looked at it, doctor?
Yes, I have. Could you please talk me through what has been happening and how long and any other symptoms that you've noticed?
Well, doctor, it has been going on for a while now. So I think it's 3 years ago. I started to
Mm-hmm.
notice that my hand is not normal, to be honest. And then I went to my GP. He gave me some exercises, and he told me, "Oh, don't worry, everything will be fine." And then the end result is my hand become. I feel that I'm becoming handicapped. I had to
Mm,
retire and give up my work that I love because I can't function anymore.
mm, mm. Okay. And that has been since 3 years. Do you think it is getting worse over time?
Definitely, doctor, definitely. You know, it was affecting one or two fingers. Now all my fingers are creepy. I don't know what to do.
Mm, mm. And anything else other than the look? I mean, do you have any
Uh,
pain, anything else that
well,
you are aware of at
yeah,
all?
doctor, sometimes it's painful, and then
Okay,
it's not only the pain, doctor. Now I cannot hold anything in my hands.
okay, okay. And when you say I can't hold anything, is that because of the pain or because of something else?
No, doctor, I cannot. My fingers are not moving as usual, doctor. You know, I feel that they are tight. I cannot fully extend them. I cannot fully flex them. I'm not sure what to do.
Yeah, yeah, I understand. And what do you think this could be as a result of what?
I'm not sure, but I keep reading. They said it might be, osteoarthritis.
Mm, mm, mm. And before that happens, have you been having any sort of any joint problems in the hands at all?
No, no, my hand was perfect.
Mm-hmm. Mm-hmm.
Then with time, I feel that my skin become thick, and I had this some, I don't know, cord maybe under my skin. I feel like cords running there. And then by time,
Mm-hmm.
I did all the all the exercises that they told me about. I bring
Yeah.
the stress ball, but it keep worsening,
Yeah.
worsening, and they just dismiss it.
All right. Yeah, I
And that's
understand
why
how
even,
that.
and that's why I changed my previous surgery. You know, I just left
Mm,
my locality, to be honest, doctor. After I closed my shop, I couldn't even live there because every day I'm
mm.
passing and seeing my shop. It just make me feeling sorry for myself.
Yeah, I understand the impact of that on yourself. It's quite distressing when somebody is frustrated, he can't do their love job. And what have you been doing since? Have you been doing any other work or?
No, no, doctor. What I would
Hmm.
do, I cannot do my gardening. I cannot, well, even I can't prepare proper meal for myself. But now I'm
Oh,
depending on
yeah.
my wife. My wife is the one who's
Oh,
having the job. I have some saving. I was working very good, so I have some
yeah.
saving. But I'm not sure. I'm just 55, doctor. For sure
Yeah.
the saving will not be enough.
Yeah. Yeah. But you never had any trauma there. Am I right here?
Trauma mean you mean injury to my hands? No, I
Yeah.
didn't have
And
any
any.
injury. No.
All right. And they both started on the same time. So both hands in the same time.
No,
Am I
no,
right?
no, no, no. I think my right hand started first, and then, my left hand started to
Mm.
be affected as well.
All right. Yeah. And are you right-handed or left-handed?
I'm right-handed, doctor.
Okay, yeah, I understand. And can they become swollen, the joints, I mean, can they become swollen and painful at all?
Well, I don't think so. The joint recently started to become, little bit funny,
Mm,
but I think that because
yeah,
these things running in my finger, my palm are becoming very thick, and that's why even I can't
yeah.
extend my, I don't know. I
Y-
really don't know.
Yeah, yeah, yeah. I understand how hard it is when you are not able to use your dominant hand. I understand that is a struggle. And is it affecting only the hands, no other parts of your body? Am I right here?
Other parts like what, doctor? I'm not sure.
Like any have you noticed any change on your feet at all, like a similar thing like that?
No, not really.
N- No. All right. Okay. Yeah. And you said it's getting worse and it's affecting your job and you lost your job. So I'm going to ask you a few questions. Do you suffer from any medical condition that you are aware of?
Um, no, doctor, I'm not taking any tablets, if this is what you are asking.
So do you suffer from any diabetes or pre-diabetes?
What is that?
It's like high blood sugar.
I'm not sure. My last GB didn't do anything. I'm not sure. They didn't investigate anything. I'm not sure, doctor. But I don't think so. I'm not
Okay.
sure.
Okay. And have you noticed any, like, have you had any diagnosis of liver disease, for example, or anything like that in the past?
Oh, doctor, I will become worried now. Do you think that's related to my liver?
No, I'm just checking because that can be caused by multiple conditions, and sometimes there are no explanation. Sometimes it runs in the family. That's why I'm asking to identify if there is any conditions causing this. So it's just general questions to know what exactly has caused these changes in
To
your
be honest,
hands.
no, doctor. I'm not sure, but I don't think I have any liver issues. No one told me that
Yeah.
before. I'm not sure. Yeah.
Yeah, yeah. And do you mind me asking, these are general questions that we ask to everybody. Are you on any medication prescribed by doctors or taking any medications over the counter?
No, no, doctor. I'm not taking any medication. Maybe paracetamol or something
Right.
when I have pain.
Okay. Do you do any drugs at all?
Drugs. You like
Hmm.
what?
Like substance misuse or anything like
Oh,
that?
no, 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 doctor. No, no, no.
Right. In terms of alcohol, do you know how much do you drink?
Oh yeah, doctor. I like my beer. I drink, 2 pints of beer every day.
All right. Is that 14 units per week or more than that?
Well, I'm not sure how much is the unit.
Mm, So you drink two beers per day. Is that over the weekend as well?
Yeah, yeah, even over the weekend. Because usually I was working over the weekend. Yeah, but that,
Okay.
yeah.
Okay. Have you noticed any distension to your tummy at all?
Distension, you mean bloating, doctor? No, no, I didn't notice any
Yeah, like
bloating.
like yeah, your tummy is slightly bloated and distended,
No, not really.
and you're not yellowish. I mean, your eyes don't look yellowish or anything.
No, no.
All right. And do you have any family history of similar problem like that?
Well, to be honest, I'm not sure. Doctor, I never know my parents. I was fostered. I'm not sure.
All right, yeah, yeah. Okay. And what's your main concern here?
Well, my main concern, doctor, I'm not able to function anymore. I want to return to my
Oh,
work.
absolutely, absolutely. And you want to, what are you expecting from this consultation? Like, what do you want me to do for you?
Uh, well, doctor, I read an article, for something I think similar like that, and they said the GP can refer me to do acupuncture because when I
Yeah,
when I
yeah.
search about people doing acupuncture, it's very expensive. So I was hoping if you can
Mm-mm.
send me for acupuncture, maybe.
Yeah, yeah. All right. So the acupuncture is one thing you wanted to try. Am I right here?
Oh yeah, doctor, if you can.
But have you tried anything else?
No, just as I told you, doctor, this the stress balls and trying to do
Mm, mm.
just he gave me a sheet of exercises to my hands and I'm doing it. I
Yeah,
was doing
yeah,
it rigorously, but now I can't even hold the ball.
yeah. Yeah, yeah. And in terms of what you've said already, I think we can book an appointment for face to face. So I would be able to examine your hands, check the range of movement around the joints, check if there is any other joint involvement. Then I would also need to check if there is any lumps or bumps. I'll examine your abdomen. I'll examine your general body. I'll check your vital signs like pulse and blood pressure. And after that, we might request a set of bloods, including diabetes, including liver function tests, including your kidney function and that is just to check if there is any underlying cause of this condition. And is that what you wanted from me? Is that something you would like to do?
Oh yeah, yeah. Well, thank you for being thorough. Well, anything I'm happy
Yeah.
with, but then what we will do with
Yeah.
my hand? Would you refer me for acupuncture, doctor?
I think after examining you, if it is really bad, we might need to refer you to the hand surgery. Meanwhile, if there are any new symptoms and
Sure.
they are getting any worse, I would like to see you even before the appointment time. Yeah, and be mindful when you're using your kettle or if you're using any sort of electrical machines because we don't want accidents at home. All right?
Surgery, doctor. But I don't want surgery. And why surgery? What I have, doctor?
This is a condition called Dupuytren contraction. It might affect one hand or both hands, and sometimes there is a cause of it. It can be caused by multiple conditions. That's why we need to arrange for set of bloods, and or it could be just a condition that runs in the family. It is because of thickening in the covering of the tendon and ligament in your hands, and that's why you can feel like a cord in the hand.
Okay, okay,
Yeah.
okay. And it should be there's no other solution other than other than the surgery. And is it safe surgery, doctor?
Yes, it is. They will try to reduce that pressure on the ligament and tendon so you will be able to move. It's like releasing the tension on that covering of the tendon and ligaments, and you will be able to function and you will be able to like perform normal function as before. Because it is thickened, you are unable to move your ligament and tendons.
Okay, thank you, doctor.
Thank you very much.
Okay, well done. What do you think?
Thank you.
Yeah, what do you
Oh,
think?
I,
What you can do better? What you can do?
yes. So I did not look at the stopwatch. So when I
That's
looked, it
important.
was past. I only had 3.5 minutes, and I should start the management even before then. I think, yeah, I spent a lot of time data gathering.
Yeah, I think
Um,
you because you was thinking. I mean, but your data gathering was sufficient to be honest. Okay, and as we said, the timing usually is the last thing that you will improve. Okay, this is the last thing that you will be able to improve during your
mhm.
journey of learning. Okay, what else?
uh, I think I left expectation to the very end of data gathering.
Yeah, that's fine. That's not wrong. Yeah, that's fine.
Okay.
That's absolutely fine. That's not wrong at all. But what else?
Yeah. So, well, I am waiting for your feedback
Yeah,
because,
well, yeah, your specific feedback will be in separate video, but in general, when you come, when you start the management of a case, you need at least to give the differential diagnosis or the diagnosis. Okay, that's why until the last moment, and actually you finish your case without telling me what I have. You said I will refer to
yeah.
the surgeon, and then for what? That was very abrupt. You didn't give any
Oh,
any
yeah.
yeah, you didn't give any at least warning sign. Surgery is surgery. Yeah, for us as a doctor, surgery is not something maybe major, but for the patient, that surgery, no. And in the hand, double no. So
Yeah.
At least from the
Yeah.
beginning, start and explain to the patient what you are thinking of. Okay, I think, from what you told me
Mhm.
and from what's in the picture, I think you have what's called Dupuytren contraction, which, thickening of the, of the tendons of your palm, okay, and your hands, and it's very common, very, little bit assured, very common, very treatable.
Mm.
Okay, I do appreciate you did a lot of in your, physiotherapy or in exercises, and it's not effective, and obviously now your hand is, severely affected. Okay, I would like to bring you in. I want to examine your hand, see if this, if this contracture is static or dynamic, because that's important. Okay,
Mm.
if it's static contracture and deformity like this more than 20 or 30 degree, that's need an operation. Okay, if it's dynamic, contracture, then still there is, there is an option for the physio, and try to strengthen or try to lengthening the shortened tendon again, although it will be painful and will take more time. and
Mhm.
and then and then tell him, okay, I do hear you that you are asking about, you need to address his eyes, okay, the acupuncture.
Mm.
Okay, but actually there is limited data regarding the effectiveness of the puncture. Okay, and actually
Mm.
most of the dinners and one of our dinners is not covered by the NHS. Again, it might be not useful for you. Okay, so
All
what
right.
we usually do in these cases, yeah, we can, I would like you to come in. I want to examine you. I will need to do some blood tests to make sure that there is no other cause for it, okay? And what are the causes? But this is the differential, okay? What are the causes that
Mm.
is running in your mind? Yeah, I heard that you have a liver disease. I heard that you have, high blood sugar and diabetes. Okay, but also you need to do cardiovascular screening, okay, because there is association between, the fibromatosis, okay, diseases, and and the connective and the cardiovascular disease. Okay, so blood
Yeah.
pressure check, okay, lipid profile that need to be done. Okay, also I didn't hear
Yeah.
you asking about connective tissue disease. Okay, eye problem, rash, okay, joint issues other than the hand joint. Okay, that was important to be asked. You did ask about palmar fibromatosis. Sorry, plantar fibromatosis. That was good from you, but you need to ask about the third one, which is important as well, which is Bayroni disease. Please don't forget. So palmar Dupuytren
Peyronie
contraction.
disease. Yeah.
Yeah, yeah. So,
Yeah. Yeah.
Dupuytren contraction, Bayroni disease, and plantar
Yeah.
fibromatosis, they are, coming in a package usually. So take care of that.
Okay.
You might ask him about,
Yeah.
have any thickening or plaque in your, sorry, to ask around your penis, because there is a strong association. You did ask about family history. You did ask about smoking, sorry,
Yeah.
alcohol, but then, don't expect from the patient that he knows. Not all patient will know how many units. You need to know that. Okay, you
Mm.
need to know
Mm.
how many
Right.
units is the how many units
Yeah.
is the you hear me? Yes.
Yeah. Yeah. I understand. Yeah.
Yeah, yeah, you can hear me.
Yes, I can hear
You
you.
can,
Can you
yeah,
hear
okay.
me?
Yeah, yeah, yeah. So you need to know how many units per pint of beer. Okay. So
Yeah.
pint of beer
Yeah.
is 2 units. So 2 pints of beer. This means 4 units per day. So he's taking double the dose.
Mm.
Okay.
Okay. Yeah.
Um. So these would be the differential, and then the other differential will be, yes, you said any trauma in your hand, septic arthritis. Ask you have any infection in the hand from before or not. Okay, that's also one of the things that need to be asked. Okay, and then tell me, yeah, after we do all of that, we might consider referring you to, to the hand surgeon. I'm not saying that
Mhm.
they will do an open hand surgery. Sometimes they can do closed hand surgery. So, okay, needle fasciotomy, they can do it. It's a day surgery. Okay, or they can do an open hand surgery. It will be depending on what the surgeon will say, and it's very common and easy surgery. Okay, and I'm sure they will be able to help you. And the good thing that you can return to the normal function, and you can return to your to your work that you love, and you can open your
Yeah.
mechanics again. Okay? Give him some positive hopes there,
Yeah.
so he will not be worried much. Okay.
Yeah.
um
Yeah.
the other thing you need, yeah, I think. you when you said worsen, when your symptoms is worsen, um, or the red flags was very broad and non-specific. So you
Mm,
need to give a you need to give a specific specific red flags. Okay, and then arrange with him now what is the when he will come, and then follow up plan as well. Okay, after if he, I would do the referral because it's affecting your mental health, because he obviously having mental health issue. Okay, and
mm,
affecting your with affecting your job and you stop working. I will send it as an
mm,
urgent. Okay, and if the acknowledgement didn't happen within a month or 3 weeks, let me know, and then we can send them again or expedite your the referral, and we'll see what we can
yeah,
do. Okay.
yeah, yeah. Amazing.
um
Thank you.
yeah, yeah, so that's in general. However, I will do some paper regarding the Dupuytren contraction, have all the details in. I will send them in my group with the recording. I will just close the feedback, the general feedback recording now, and then we'll give you your specific, feedback. Okay.
Okay.